Hi again, this is Jennifer Dufresne, registered dietitian. I changed my background, so the topic today is aspiration pneumonia, and I decided to have a little bit of water in the background, just in case it reminds you of aspiration, and then also talk a little bit about options with aspiration pneumonia. I get this question a lot. What is it? People will call aspiration pneumonia when they're told their loved one has it ammonia. I'm told my mom has ammonia. It's not ammonia, it's pneumonia. And there's a couple different kinds of pneumonia, but if it's specifically called aspiration pneumonia, it's they have aspirated into their lungs. They're still eating or drinking, and it's going down the same pipe right here, but one way goes to the lung and one way goes into the stomach. And when we eat, we want food and beverages to go into the stomach, of course. But when these muscles weaken, they can be called dysphagia. And if you've heard that term, probably likely before your parent got diagnosed with this aspiration pneumonia, because if they have dysphagia, they're having difficulty swallowing, and those muscles can come back. They may not come back. Many times right after a stroke, or when somebody loses a lot of weight or loses function, they become very weak and they lose the muscles to the ability to swallow. And then the speech pathologist will usually do a test on them that involves looking at how they eat and swallow. Sometimes it's under x-ray, sometimes it's not, to determine if they're aspirating food into the lung. If that is the case, they will put the patient on a specific diet. It could be mechanical soft chopped. It could be finely chopped. It may just be puree. The most restrictive of all those, worst case scenario, would be puree, thick liquids. And there's 3 different kinds of thickness, but the thickest looks something like pudding. But oftentimes I get asked the question, if my parent is on something as thick as pudding, how in the world are they going to stay hydrated? Well, they do, because once it's the fluid stays thick just long enough for it to pass through the place that's difficult. Once it gets down to their stomach, it turns back to water. So they stay hydrated. It has the same content as liquid as it did before it was thickened. So once it's thickened, that is just simply to help it go down into the right pathway. So if your parents put on a puree thickened diet, you'll want to watch another video that gives you some ideas of what to feed them. But this video is specifically meant to discuss what aspiration pneumonia is and what the scenario, the worst case scenario could be as far as the diet. Worst case scenario is the doctor will say, or the speech therapist will say, really, they're not even able to eat or drink at all, even the thickest food and the thickest liquids, pureed, like soup and thickened up, without aspirating into their lung. And if that's the case, they may offer 2 options. They may say, well, let's put a tube feeding into the stomach to feed your loved one. Or they may say, okay, that's kind of aggressive. Maybe your parent isn't even strong enough to withstand going through getting a feeding tube placed. So they may want to put them on palliative care or hospice. And if that's the case, it doesn't necessarily mean they're going to pass away right away. Many times people have the impression that when they go on hospice, they're immediately going to be put on morphine, they're going to fall asleep, and they're going to starve to death. And that's not necessarily the case. It shouldn't be. Hospice is not meant to hasten their death, nor is it meant to prolong their death. It's just supposed to mean the little bit of time they have left, whether it's 6 months, 6 weeks, 6 hours, make it as comfortable as possible. So if they're not in a lot of pain, they probably don't need a lot of morphine. They may not even be given morphine at all. They may just be given whatever it is needing to keep them comfortable. For example, let's talk about aspiration pneumonia. If they have aspiration pneumonia and they're not going to go for aggressive treatment, which would be considered a tube feeding, many times they'll just go home on hospice or palliative care and they say, okay, we know very likely they're going to aspirate, and we're either going to keep treating them for aspiration pneumonia by giving them antibiotics and possibly sucking out whatever is, getting, depending on the severity of it, or we are going to we're going to go ahead and not give them antibiotics. I hate to say that, but that is one of the ways people will die in natural causes. They may die of aspiration pneumonia. So my thoughts on this, once they are discharged from the hospital, or maybe they're left in the hospital on hospice and they're put on a thickened liquid diet, we're going to talk about what can you do now that they're on that. And then another presentation will go over food options. But once you've prepared the food, whatever the food is that you're going to prepare, described in another video, you're going to feed them with aspiration precautions, which means even though it's very likely they may still be aspirating, you want to minimize their risk of aspiration pneumonia. And what you can do is sit them up ideally at 90 degrees, like I'm sitting right now. Not all people towards the end of life, and when I say end of life, I'm not talking about hours. We could mean their whole last year of life, but it is the end if they lived many years. Sit them up as comfortably as possible, but try to get them at least to 45 degrees. So 90 degrees is straight up, 45 degrees would be halfway between laying flat and 90 degrees. If you can get them up higher comfortably, please go ahead and do that. Once the liquids are thickened, you're going to slowly spoon feed them. And you don't want to do this standing up, feeding them down. You want to do it at the eye level. And that's a dignity issue as well, but not just for dignity, but for safety. Feed them as if they're sitting right next to you. And wait for them to swallow. Look for their swallow. If you can tell, maybe they have dementia or maybe they're falling asleep. If they're falling asleep, you probably want to wait for them to wake up a little bit more before you feed them. But you may need to remind patients with dementia or memory problems to swallow, and sometimes just tapping them on the cheek or rubbing them here will remind them to swallow. Sometimes, even though they won't understand a complete sentence, they understand swallow, and you might be eating with them and demonstrating swallow to get them to swallow what's in their mouth. You don't want to keep feeding them if there's food in their mouth. They may be pocketing as well, which you might see chipmunk cheeks. They'll start pocketing the foods. You don't want to keep feeding that either. It's really important, if you see your parent or loved one or anyone you're caring for pocket that food, that before you lie them down flat again to sleep, you want to look inside their mouth. The worst thing that could happen is something that is stuck in their cheek. You don't pull it out and they lay flat, and then it gets stuck in their throat and have a breathing problem. So make sure that if you know and you're aware that they are pocketing the food, that you get it out before you lay them back down. And either way, you don't want to lay them back down as soon as they've eaten. You probably want to give them about an hour. They might not need to be completely straight up, but don't lie them flat down right after they eat. Wait about an hour. Also, with aspiration pneumonia, you want to make sure that not only are you cueing the patients or your loved one to chew and swallow, you probably want to give them a little bit of liquid in between their bites, not necessarily every bite. And even though they may be on thickened liquids, that thickened liquid will be more quenching than the mashed potatoes or the meat that you're giving them that's pureed. So make sure to do that as well. So as long as you're following aspiration precautions, cueing them, sitting up, making sure that they're swallowing, making sure they're not pocketing the food, that's really the best you can do. Not rushing them, allowing them to take the time that they need. And if they just stop eating because they're done, allow them to stop eating when they're done, or just sit down, relax with them, have a conversation, or however you communicate with them, and then maybe start back up feeding them a few minutes later. Give them a break to see if they just need a chance to just get that food to go down, or whether they're really full and they don't need or want anymore. Do not push them beyond their limits, because then you're going to end up for sure with aspiration when they feel way full, and then the food starts to come back up or they regurgitate it. So when they've had enough, allow their body to tell them, which they're going to communicate to you somehow, either by clenching their mouth shut, by turning their head, grimacing. There'll be a way to communicate that they've had enough, and just respect the body's natural way of telling them and telling you that they've had enough, and then try again at the next meal. So that's it for aspiration pneumonia. If you want to look for some recipes or get some ideas on what to feed your loved one with aspiration pneumonia, you can watch another video on puree, thickened liquids. And then if you would also like to look at other possibility of tube feeding, watch the video on tube feeding. This was just a brief general summary of aspiration pneumonia and what that means.